You may have been wondering, what are the benefits of exercising throughout your pregnancy besides just birth? There has to be so much more to your efforts during your pregnancy with your workouts, besides just this singular moment in your motherhood transition, which is still a really impactful moment. It is still an important part of our transition into motherhood. But exercising during your pregnancy also can really improve your quality of life during pregnancy, and it can help to improve your quality of life in the postpartum as well. And so in this video, I'm going to break down what are those physiologic changes that happen, what are the benefits of prenatal fitness besides just the birth benefits. Hey, my name is Gina. I'm a perinatal fitness trainer and birth doula and the founder of MamasteFit, which is a training facility located in North Carolina that specializes in training women throughout their pregnancy and in their postpartum with resistance training. And so our clients are lifting weights throughout their pregnancy. They are returning to lifting weights in the postpartum. And so we have seen a ton of benefits for our clients in person. We have seen a ton of benefits to our online clients. And so I want to highlight what are those physiologic changes that can happen and how those physiologic changes help to support a better quality of life in pregnancy and in the postpartum, not just birth, which again is an important moment in our transition into motherhood, but a smaller time frame than 9 months of pregnancy and years of being postpartum. Now, when it comes to the research available on prenatal exercise, it is definitely more limited. Women were not included in research studies until 1993 in the United States, and even now are definitely a smaller portion of research that we focus on, just women's health in general. And so the limitations on research available is definitely there. However, there are more researchers that are looking at the benefits of prenatal exercise. There are ones that are dedicating their career to studying prenatal fitness and the benefits of exercise during pregnancy and in the postpartum. So the volume of studies that are available is becoming slightly larger. But there are some limitations to the research, and so I do want to highlight that before we dive into this episode. But the first paper that we're going to be looking at is a newer one. It came out in 2025, 2026. And it is from Ronaldo Delago et al., and it's from the American Journal of Obstetrics and Gynecology. So it's a published paper. And this was a systematic review that looked at 11 randomized controlled trials. And what that means is they took 11 trials, they took all the data and the methods and results from them, and they kind of looked at all of them at once to see if there was any singular conclusions that we can come to. Because all of these smaller papers have good data within them, they have good information, but is there a way for us to take all of it and bring it together to see if there's one conclusion or a few conclusions that we can come to that multiple ones support? In this paper, we were looking at the impact of exercise training during pregnancy on maternal biomarkers, a systematic review. And so in this, they were looking at how does exercise during pregnancy change the biomarkers that were measured in maternal serum, umbilical cord blood, breast milk, and placenta tissue. And they found that the strongest effects were seen with programs lasting 12 weeks or longer that were performed 2 to 3 times per week at a moderate to vigorous intensity. And so moderate to vigorous intensity is a good effort. Moderate intensity is going to be anywhere from like 60 to 70% effort. If you're lifting weights, this is going to be like maybe a higher volume of lifting, like 6 to 12 reps. And when you finish, you should feel like you can do like 2 or 3 more reps before you would need to fail or bail the bar. If you're exercising like with aerobic training, you should be able to speak like a short sentence before you feel more winded. So this is a good effort. With vigorous, this is where we're getting more to like that 80 to 90% effort. With our lifts, if you were exercising more aerobically, you can maybe do like a few words before you felt more winded. And so this is a good intensity level to have during pregnancy. We do not need to maintain a super easy, super relaxed, like effort level with every single workout. And so 2 to 3 times per week, exercising at a moderate to vigorous intensity can be really beneficial to adjusting the biomarkers in a positive way. But first, let's chat what is a biomarker. This is one of those like keywords, those buzzwords that gets thrown around a lot, but it's a measurable sign inside your body that tells us what is going on. So it's almost like your body's internal report card. And there's different things that we can look at to let us know your inflammation's looking good, your glucose levels are looking good, and all that stuff. And so in this study, the first biomarker category that we were looking at was inflammation. And by we, I mean the researchers. I am just reading their paper. And so they found that exercise was associated with reductions in pro-inflammatory markers. And so different biomarkers that indicated that inflammation was lower was seen. So this was like a good sign. We do want some inflammation because this is a part of a recovery process, like our muscles and tissues get inflamed, and this kind of directs our body to send some healing aid to that area, but we don't want too much inflammation. And during pregnancy, there are some changes to our immune system and to our inflammation systems. And so exercising can help to kind of regulate that to keep it from getting too high or chronically high, which could impact things like preeclampsia and blood pressure. The next thing that it was looking at was glucose and insulin. And so they found a positive change in our glucose regulation. During pregnancy, we become more insulin resistant because we want more of that glucose to go to the baby. But if this insulin resistance becomes too high, we have too much glucose going to baby, and this can result in a complication known as gestational diabetes. And so when we exercise, especially when we have these muscular contractions that are happening, such as with resistance training, our muscles become better at pulling the glucose out of our bloodstream to use as fuel. And so you can almost think about your muscle like a sponge, like we're squeezing the sponge with our contraction, and this is kind of pulling in more of that glucose from the bloodstream to use as fuel. And so this can help to improve our insulin resistance and is one of the reasons why exercising during your pregnancy, especially with resistance training, can decrease the likelihood of developing gestational diabetes. A paper that was published in the Frontiers in Clinical Diabetes and Healthcare looked at the effects of exercise in relation to developing gestational diabetes. And this was a systematic review and meta-analysis. And so in this paper, they looked at over 3,000 records to see if there was anything that said exercise helps to decrease the likelihood of developing gestational diabetes. And now within that, the range that seemed to show up was anywhere from a 4% reduction to 61% reduction. And so that's a pretty big range, but there tends to be a conclusion that exercising during your pregnancy does decrease the likelihood of developing gestational diabetes. And now this doesn't mean that it's going to completely remove it, or that if you do exercise, you won't develop it, or that if you do develop it, you did something wrong. This is just to say that exercising can have a positive impact on this complication. The next biomarker that this paper looked at was lipids. And so lipids are fat in blood, and you can think about them as what helps to kind of transport things from place to place. During pregnancy, we have changes in our cholesterol and our triglycerides because this is going to help to provide more fuel for our babies. This is also going to help with hormone production and with our energy needs during pregnancy. And so exercise is going to help to kind of regulate this a little bit more optimally during pregnancy. The fourth category that we're looking at is the biomarkers related to hormone and growth factors. And the research find that there was favorable changes to those hormonal markers. And these are going to be things that are impacting your appetite, your energy balance, your metabolic signaling, and they are also associated with your placenta function, which is obviously a big deal for our babies. Exercise has been associated with a positive change in the placenta's volume and its functional capacity, and so it makes sense that we would see biomarkers indicating that the functional capacity of the placenta is improved. These biomarkers are also going to be associated with our brain health and nervous system function, and so seeing a positive change in them during pregnancy with exercise is obviously going to be really beneficial. And now there are some studies that demonstrate that exercising during your pregnancy has a positive impact on babies' brain development. They have improved cognitive function in their first year of life. They have improved language skills, motor skills. And so if we're having these positive biomarker changes in hormone and growth factor that are also impacting our brain, it would make sense that this could potentially be what is helping to improve the baby's brain development as well. And so exercise is not going to magically prevent every single complication that can happen during your pregnancy, but these changes in the biomarkers from exercise is indicating that we are on the right track when it comes to exercise. So it could reduce the likelihood of developing prenatal complications such as preeclampsia, high blood pressure, gestational diabetes by potentially a pretty big percentage, but it doesn't completely take it away. And so it still is important that we still do our prenatal appointments. We still have regular visits with our provider to monitor our health status throughout pregnancy. But exercising throughout your pregnancy does create these measurable internal changes in our body, these physiologic changes in our body that not only benefit ourselves for birth, our baby's development, but also our own function throughout our entire pregnancy into the postpartum. Now, the same authors also published a paper in 2025 that looked at the effects of strength training on the quality of life in pregnant women, a systematic review. So this is also another review that looked at a bunch of papers, brought them together to kind of come to that conclusion. And so this one looked at 9 randomized controlled trials, and there was over 1,500 pregnant participants. So this is like a really big deal that there's a lot of women that we're looking at and seeing what kind of data, what kind of conclusion can we come to. And it found that strength training during pregnancy may reduce excessive gestational weight gain, low back and sciatic pain. It can help to improve your mood, sleep, fatigue, muscular strength, flexibility, physical activity levels, and psychological well-being. The mental health aspect of exercising during pregnancy and in the postpartum is usually kind of downplayed, but it is incredibly beneficial to helping you feel good within your body, mentally and physically. And I tend to find that if you feel physically good in your body, it's a lot easier to feel mentally well as well. And now this is something that we have found time and time again with our clients as well. When we strength train during pregnancy, the pain and discomfort that you may feel definitely goes down. For me in my own pregnancy, whenever I kind of skipped a bunch of workouts, my sciatic pain and my SI joint pain would definitely flare up. And that is definitely a trend that we see with our clients, both in person and online. The ones that kind of report back like, yeah, I took a bunch of days off and my pelvic pain started to kind of pick up, but then I went back to the gym, I did my workouts, and it was resolved pretty quickly, is kind of something that is just repeatedly appearing for us with our own clients. And so we haven't done any of our own research in this specifically, but it's nice to see it kind of supported with what we're seeing in research papers online, is that exercising during your pregnancy is going to help you stay more comfortable. It's going to help to decrease the discomforts that you may be feeling, such as the pelvic pain, the lower back pain. Because when we are physically stronger within our bodies, we can adapt and adjust to the physical changes that are happening. Because we have our center of gravity that is growing with our belly. It's shifting it forward and upwards. That's going to change the way that we tend to stand. We tend to posture ourselves. There's also more weight on the front, which we really need that strong posterior chain on the back side of our body to help counter that. And when we strength train, it's going to help us to be stronger, to move more confidently during our pregnancy and more comfortably. Now, you might be wondering, well, what about high intensity resistance training? Can I do that during pregnancy? Is it safe for me to do? Because there still is this stigma and this thought that we need to have low effort, gentle exercises to do. Don't lift too much weight. Don't work too hard. Don't get your heart rate up too high during your workouts, when none of that is necessarily true or founded in research. So you can do more vigorous intensity exercise during your pregnancy, but there are limitations to it. In a paper that was published in the British Journal of Sports Medicine, the maternal and fetal responses to acute high-intensity resistance training during pregnancy, they looked at this high-intensity resistance training to include barbell back squats, bench press, and deadlift, looking anywhere from 70, 80, and 90% at 10 repetitions, with and without the Valsalva maneuver. The Valsalva maneuver is essentially a breath holding strategy. So you're holding your breath, which is going to help to stabilize the spine during heavier lifts. And so if you look online and you see somebody who's lifting like in competitions or really high weight, They are going to take a really big inhale before they even begin their lift to brace within their abdominal cavity. And so this is the Valsalva maneuver. They're then going to hold their breath as they lower in the squat and then continue to hold their breath as they come up to maintain that pressure within the abdominal cavity. Pressure is really good at helping everything be really stable. So if you think about a can, if this can is closed and it's filled, there's a lot of pressure within this can. And so I can stack a bunch of stuff on top of it and it's not going to collapse because this core canister here, this can here, is very stable within inside. And so that's what we're doing with these heavier lifts is we're increasing the pressure internally so that way we don't collapse underneath the heavy load. Now, if I open the can and then I drank a bunch of stuff out of it and then it's just kind of an empty can with very low pressure, if I put the same weights and stuff on top of it, it would just crush underneath. And so that's why the Valsalva maneuver is utilized with heavier lifting because it helps to stabilize the spine with internal pressure more so than just clenching your abs or your back muscles would be able to do. Pressure is much stronger than simply muscular activation. Now, with the Valsalva maneuver, there is some thought that you shouldn't do it during pregnancy, that there's too much pressure and this could have a negative impact on the pelvic floor. However, what we have found with our clients is that they can still do a breath holding strategy without any issues with their pelvic floor because we're not lifting 1 rep maxes, but being able to maintain stability within the spine is still important. So the amount of pressure that we generate is maybe not going to be the same amount as if I was doing a 1 rep max, but I still want to have some sort of stabilization if I'm going to be lifting at a heavier load with that 70 to 90%. And so in this paper, they found that those that were doing the Valsalva maneuver, the authors concluded that exercises were well tolerated by both the mother, so the person that was lifting the weights, and the baby, even when they were doing the Valsalva maneuver. And so this is a really big deal because, again, you may have seen content that tells you should never hold your breath with your workouts, but holding your breath with your workouts can help you to stabilize better during lifts, and lifting weights is beneficial during pregnancy. Another study that was published in the Journal of Sports Sciences in 2025 by McCarthy et al., they looked at the maternal and fetal cardiovascular responses to moderate to high intensity resistance exercise sessions. And so this was a smaller study. There's only 37 people within it. And they had them do 8 rep max for squat, incline bench, deadlift, lat pull down, leg press, row. And then they completed a resistance session with fetal and maternal monitoring. So they had monitors that were looking at the mom and the baby. They found that the baby's heart rate exceeded 160 beats per minute for more than 2 minutes, but only in about 15 instances. So this was about 2.3% of the time. So they concluded that babies were well tolerating this, but they did recommend extra rest between sets to allow baby to kind of have their heart rate come down and to normalize. And so not every person should be lifting super heavy weights during their pregnancy, but if you want to lift heavier weights during your pregnancy, you can do it. If you want to hold your breath with your lifts, you can hold your breath. Now, if you are doing a higher intensity workout, incorporating more rest breaks can be beneficial for you. And then also paying attention to how you feel, like truly listening to the signs that you are feeling within your body. If you are feeling more fatigued that day, if you're feeling lightheaded or experiencing any feelings of like dizziness, anything that is letting you know that this workout is too hard for you or you're bailing the bar, we need to kind of ease off from that. And so each day of pregnancy, when it comes to lifting weights, you do need to be more mindful of how you actually feel and being okay with adjusting without worrying about the ego. Now, a lot of these papers that look at resistance training during pregnancy kind of just tell you that it's beneficial, you should do it, exercise is good, these are all the good changes that happen, but there's not a ton of guidance on like what exactly to do. So we can't look at this paper and then this paper is going to tell us that everyone should do 3 rounds of 10 reps of these 4 exercises for the best outcomes, because there's going to be no paper that really looks at that specifically for really any workout protocol, and especially during pregnancy. And so what we have to kind of do is look at the research research studies out there, look at the papers and stuff that are out there, and then we make our conclusions on how we can develop programs that help to support that. So the way that we approach programming here at MamasteFit to help look at all the benefits of research and bring that into an actual program that you can follow is, one, we focus more on strength endurance programming with our prenatal fitness programs. We need more of an endurance capacity, we need more stamina, we need more postural control to help us maintain a more upright position throughout our pregnancy so that we can counter those big changes that are happening. And so we are going to be focusing more on that endurance capacity with resistance training. So these are going to be anywhere from like 8 to 12 or 20 reps to help us feel stronger within our body for a sustained period of time. And we incorporate a variety of different types of movements as well. So we have our standard sagittal plane movements with bilateral stance, so both legs working together, both arms working together, such as our squats, our deadlifts, hip thrust, bench press, overhead press, and our rows. And so we have our standard strength building exercises included within our programming because those are what is going to help you get stronger. These are going to be our higher rep, more heavier weight movements that we're going to be doing. Now, the other thing that we need to incorporate are going to be all of the accessory work because we don't just live in the sagittal plane, and our pelvis is going to open more in the rotational, in the frontal plane as well. And so we need to make sure that we incorporated single leg movements that incorporate all the different hip positions and changes. So not just flexion and extension of the hip, but also abduction, so the legs moving apart, adduction, legs coming together, hip internal and external rotation, and pelvic internal and external rotation are going to be important movements to incorporate within our workout routine. In addition to the upper body, so we want rotation in the thorax, we want some lateral movement with the arms and with the shoulders, and we want rotational movement happening within the shoulders as well. And so we have to kind of look at these big joints and think about what type of accessory work can we incorporate to help somebody move better. The other thing that we incorporate within our programming that we found to be really beneficial is going to be myofascial sling work. So connecting the upper to the lower body with our myofascial slings. And so this is our anterior oblique sling from the chest to the opposite inner thigh, posterior oblique sling, lat to opposite glute on the backside. We have our lateral sling, which is going to be around one leg, helping with that single leg stability. And then we have our deep longitudinal, which is essentially along one side of our body, which brings us to the final thing that we incorporate pretty heavily into our programming, which is going to be the posterior chain. And so we have a little bit more weight to the front side of our body. And so we find when we strengthen the back, the glutes, and the hamstrings a little bit more, that helps us to counter that weight shift to support postural control. And so research papers may not be giving you a daily workout that you can do, but we can understand that exercise during pregnancy is generally safe, especially if you don't have any contraindications, we don't have any complications that are preventing us from being able to exercise during our pregnancy. We can lift heavier weights. We can do the Valsalva maneuver. There's a lot more freedom to exercising during our pregnancy that we may have realized. And research helps to support that it is safe for you to do and beneficial for both you and your baby. Now, if you do want that daily workout to help guide you throughout your pregnancy that has evidence-based research in mind, check out our prenatal fitness programs where it is a daily workout that you can follow each day, each week of your pregnancy. We offer our prenatal fitness programs as a standard workout delivery where it's a list of exercise with demo videos in the Team Builder app. This is going to sync to your current week of pregnancy, and this is for somebody that likes to work out at a gym, that wants to lift with a barbell throughout their pregnancy, because we do offer modifications based on where you're at during your pregnancy that we have found to be most beneficial for our in-person clients. But if you would prefer, you can also do our video-based prenatal workout program, our on-demand program, where it's going to be a full-length video that you follow and work out with at the same time, which can be great for home use or for gym use. And so you can check out all of our fitness programs on our website at MamasteFit.com. There's both one-time purchase in addition to monthly purchases depending on what your need. Both programs sync to your current week of pregnancy and include all of the strength exercise, the accessory work, the core work, the pelvic stability work, and the birth preparation. Because while there are tons of benefits to prenatal fitness outside of just birth, it is usually a focal point that a lot of us are thinking about. So check out all of our programs on our website at MamasteFit.com, and you can use code YouTube10 to get 10% off any of our online offerings. And if you have come across a paper that you would like some more information on, you would like to understand the nuance of it, comment down below and I'll reply and let you know my thoughts.